Greetings. So, by this time, you should have viewed all the arthritis, and as you can see, there's several of them. So, the question is, how does it show up on tests, and how can I separate them on tests? Okay, so that's the purpose of the video, is we're going to do a review on arthritis, joint pain, and joint swelling. Because I think it's going to have definitely implications for your exams and separating in your exams what is being asked. And then again in life as well, that's how you look and see what you're coming in with. Okay. So let's say the patient comes in with joint pain and swelling. The first step is there signs and symptom of inflammation? So if there's redness, heat, okay, ESR-CRP is elevated and you're given fever, malaise, and constitutional symptoms, you have inflammation. If the question doesn't give you, or the question says explicitly there's no fever, malaise, ESR-CRP is normal, and there's no redness or heat with the swelling, then guess what? This is not inflammation. So first decision tree, your joint pain and swelling, is it inflammatory in nature? So again, if there's no redness, no heat, ESR-CRP is normal, no constitutional symptoms such as fever and malaise, it's non-inflammatory. It's osteoarthritis is what they're trying to tell you. Now, what are other things that can shore up that diagnosis? They'll give you probably an older person, pain that's worse at the end of the day, AM stiffness, which is less than 30 minutes. Okay. What causes osteoarthritis? Remember, that's a bad name. It's actually degenerative joint disease. It's biomechanical stress and wear and tear. So they'll give you joints such as knee and DIP. It's asymmetrical. Okay. Remember, the inflammatory or not is the big thing, and then the rest of it adds on to, yeah, that's what it's sounding like to me. Okay. What do you do about it? Remember, you rule out the secondary factors that are causing this disease, decrease the biomechanical stress by managing overuse and weight, and then last but not the least, you have pharmacotherapy and non-medication approaches um, that were covered for osteoarthritis. Okay, so that's osteoarthritis. And if you're not sure, want to look at it in detail, you can review the video again. If the symptoms are inflammatory, so in other words, you do have redness and heat, you do have fever and malaise and some of the constitutional symptoms, and your ESR-CRP is elevated, this is inflammatory. Now you have some choices. If the question says that it is acute monoarticular, so it's one joint, and I was okay yesterday, and today I can't use that joint, that's acute and monoarticular. Then you've got four choices: trauma, infection, crystal, and reactive arthritis. Trauma, you'll get a history. Infection, the next step would be to do an arthrocentesis, because this is the one we want to make sure we don't miss. Because if we miss this one, A, it's going to kill the joint. B, it's going to actually cause sepsis, septic shock, MODS, multiple organ dysfunction syndrome, and death. Okay. Crystal disease. Okay. Where it could be Homer Simpson or Grandpa Simpson, and or reactive arthritis. So again, trauma will give you a history of trauma. Infection would generally be indicated by arthrocentesis, with pus coming out. Okay, there's going to be a history of STD or bacteremia relate in his IV, drug use, which may cause bacteremia or other things that cause bacteremia. And we treat the infection. If it's gonorrhea, we treat the gonorrhea in the joint. If it's Staph aureus, we treat the Staph aureus. Okay, so that's infection. Acute monoarticular, history of trauma, we get trauma. Infection, we have history of STDs, or there's something that's seeding the blood with the bug, and that's actually seeding the joint, such as IV drug use. Crystal disease, again, we are still on monoarticular, would be a middle-aged male, Homer Simpson, who drinks Duff beer, alcohol, eats red meat, and the first metatarsal joint is inflamed. That big toe is inflamed. That's called podagra. The question is wanting to make sure if you know about gout. Okay, they're trying to tell you gout. And what do you do about it? Manage their uric acid to prevent progression to chronic tophaceous gout. Acute attack you manage with a few medications, and you can review the video of gout to get a better idea. Crystal disease to get a better idea. The other form of crystal disease may be an older male, like Grandpa Simpson, Abe Simpson. They come in with knee pain, which is acute and monoarticular. And again, we treat it like gout acutely, and then we screen them for things that may cause high calcium levels. Acute monoarticular arthritis could be reactive, which is like Quagmire and Family Guy. Can't see, can't pee, can't climb a tree. So they come in with conjunctivitis, urethritis, and arthritis. Okay? Essentially, if they give you that triad, it's reactive arthritis. So you screen them for non-gonococcal infection in areas where it can be there. For example, chlamydia can be there, which is a non-gonococcal infection in the throat, in the anus, in the vagina, or you could have urethritis or urethral symptoms, so urethral swab. And if it's there, treat them for chlamydia, gonorrhea, and do the STD screens. The arthritis is treated by NSAID and time. And again, if you're not sure, view that video. Okay, so that's acute monoarticular inflammatory arthritis. If, however, your question says, yes, they have inflammatory arthritis, so they do have increased ESR/CRP, the joints are hot, red, okay? However, it's chronic in nature, and there's more than one joints that are involved. Now you have 5 things to consider and 5 different scripts that the question is going to present. And they're actually not that difficult. So you can have psoriatic arthritis, which is psoriasis plus arthritis, that you treat with NSAIDs and DMARDs. Big thing to remember here also is psoriasis treatment does not treat or help arthritis. You can have ankylosing spondylitis, a younger male with low back pain or sacroiliitis. AM back stiffness, which gets better with activity. They're trying to see if you understand ankylosing spondylitis. Okay. Third one is inflammatory bowel disease. So they've got history of ulcerative colitis or Crohn's disease, and then they've got arthritis, which is chronic and polyarticular and inflammatory. You got inflammatory bowel disease spondylitis. Okay. And we treat the IBD or the ulcerative colitis or Crohn's disease, and the arthritis actually gets better. This is different from psoriatic arthritis. Last but not the least, there's 2 of them, lupus and rheumatoid arthritis. Very, very difficult to separate sometimes in real life. But on questions, it's actually not that hard because for lupus, they'll give you a minority, African American, Hispanic, or Asian female. For rheumatoid arthritis, they'll give you a Caucasian female. So Loretta from Family Guy for lupus and Lewis from Family Guy when it comes to rheumatoid arthritis. Okay, with rheumatoid arthritis, they'll give you AM stiffness, morning stiffness greater than 1 hour, spares the DIP, rheumatoid factor, and anti-CCP positive. And then they may give you rheumatoid nodules, you know, which is gonna make this more rheumatoid arthritis. Now, how do we treat it? Methotrexate. Lupus, Loretta. Generally, they'll give you arthritis plus positive ANA. And then they would have SOAP MD symptoms. The big ones are malar rash or photosensitivity. Okay. And the treatment for lupus is hydroxychloroquine. Okay. So that's sort of how, as you're given a question, you can tease out, well, where are they going with this? What is the illness script? Is it non-inflammatory joint swelling and pain, which is osteoarthritis, or inflammatory joint pain and swelling, which could be acute and affects one joint, in which case I look for history of trauma, history of infection, with history of STD or bacteremia, and arthrocentesis that gives me pus. Or I get crystal disease with Homer Simpson, who's a middle-aged male, and my question drank alcohol, red meat, and has podagra, right? Or is Grandpa Simpson older male with knee issue, knee acute monoarticular inflammatory arthritis? Or is it Quagmire who can't see, can't pee, can't climb a tree? Or is this arthritis inflammatory, but more of chronic nature and affects several joints, in which case it could be psoriasis plus arthritis, psoriatic arthritis, or a younger male with low back pain and AM stiffness that gets better with activity, ankylosing spondylitis. Or the patient has ulcerative colitis or Crohn's disease, that's inflammatory bowel disease plus arthritis, so that's IBD spondylitis. Or the patient is Loretta, Family Guy, African American, Hispanic, Asian female with positive ANA and a malar rash and some symptoms of SOAP MD, MD SOAP brain, right? That is lupusy that gets treated with hydroxychloroquine, unlike rheumatoid arthritis where Caucasian female Lewis has arthritis and then AM stiffness greater than 1 hour that spares DIP and positive rheumatoid factor and or positive anti-CCP. Here the first line is methotrexate. That will help you tease out what questions are asking you and which disease they're trying to target, and having you chase the right disease.